Good evening, everyone. I'm Dr. Darshani Hettiarachchi, consultant child and adolescent psychiatrist, currently working at Teaching Hospital, Karapitiya. So today I will be discussing how we can help children to cope with grief and loss during COVID-19 pandemic. I think this is a timely required topic because, as we all are aware, currently the number of deaths are rising and so many adults and children tend to lose their loved ones. So it is important as healthcare workers to know how we can support them and how we can help them to cope with these losses. So before moving into my presentation, I will give you two case scenarios. Case number one, a 6-year-old boy, mother has died from COVID-19 infection. Child has not seen the mother for 2 months due to mother's hospitalization. I got a call from this child's father. Actually, he was a medical officer. Whether the child should be informed about his mother's death and should he attend the funeral. I hope you will be able to answer this question at the end of my presentation. Second case, a 11-year-old girl presented to child psychiatry unit with medically non-responding chronic headache syndrome for 6 months. Her father has died from COVID-19 infection 8 months back. Child has not been able to attend the funeral due to health restrictions. On assessment, she drew her family with father alive, and she denied to accept that her father was dead. So these are the clinical scenarios we may come across in the future if we do not help children to cope with current losses of their loved ones. So in my presentation, I will be focusing on what is normal grief and stages of normal grief, and what is abnormal or complicated grief, and grief reaction in children, and how to support children during grief. Let's see what is normal grief. It is the emotional, cognitive, functional, and behavioral responses to the death, as well as the response to other kinds of loss. For example, loss of their youth, of opportunities, and of functional abilities, etc. It is a normal, natural, necessary, and adaptive response to a loss. The symptoms can differ considerably in intensity and length among cultural groups and from person to person. So, what are the functions of normal grief? Actually, normal grief is something which is essential. It helps people to accept the reality of loss, and it helps to make the outer reality of the loss into an internally accepted reality. As we all are aware, when someone loses their loved ones, we usually go to a denial that we can't accept that this has happened. So it is important to make the outer reality of the loss into an internally accepted reality, and redefining the relationship with deceased. Because initially the person has lived with the loved one, now the person is going to live with the memories of the loved one. To lessen the emotional attachment to the lost person and adjusting to the environment without the deceased. And also it helps to withdraw the emotional energy from deceased and reinvestment in other relationships and activities, and also to make it possible for bereaved person to become attached to other people. So these are the functions of normal grief. What are the stages of normal grief? Kubler-Ross, a famous psychologist who has done many researches, who has conceptualized many theories, has named these stages of normal grief. So initially when someone get to know that their loved one is lost, they go to a shock. And then they go to denial and frustration, and later to depression. After this step, they gradually start raising up their activities. So they start experimenting, start taking decisions, and then gradually move on to the integration to the normal life. So main stages are denial, anger, bargaining, depression, and acceptance. So actually what happens is, like in majority, grief is never fully completed. I think that is something which we all should be aware. So what happens is this acute grief or this acute severe grief is transformed into integrated grief. Usually this takes nearly 6 months for someone to move from acute grief to integrated grief. So what are the features of acute grief? This occurs in the early aftermath of the death, which is intensely painful, intense sadness and crying, preoccupation with thoughts and memories of the deceased person, disturbed neurovegetative functions like sleep, appetite, difficulty in concentrating, relative disinterest in other people and in activities of daily life. But after they move on to the integrated grief, there the wounds begin to heal and the bereaved person finds his or her own way back to a fulfilling life. And the reality and meaning of the death are assimilated. And they are able to engage once again in pleasurable and satisfying relationships and activities. They do not forget the people they lost, relinquish their sadness, nor do they stop missing their loved ones. But this loss becomes integrated into their autobiographical memory, and thoughts and memories of the deceased are no longer preoccupying or disabling. Now they can live with the thoughts and they can function normally with the thoughts and memories of the deceased. Now they do not persistently preoccupy the mind or disrupt other activities. However, there may be periods when the acute grief reawakens. For example, around the time of significant events such as holidays, birthdays, anniversaries, another loss, or a particular stressful time. So that is why I said this grief is never fully completed. So what actually happens in normal grief is at the end, this grief is transformed into integrated grief where individual starts living with memories of the deceased and to start living their day-to-day functioning. There is no evidence that normal or uncomplicated grief requires any kind of formal treatment or professional intervention. It is a natural process. So, what are the types of grief? Anticipatory grief. It is the feeling of grief occurring before an impending loss. And normal grief, which occurs in nearly 50 to 85% of people after loss, which I earlier, and complicated grief, which occurs nearly 10% of people after loss, which I will be discussing after this, and disenfranchised grief, where hidden grief or sorrow refers to any grief that goes unacknowledged or invalidated by social norms. Example, extramarital lover. And the children's grief. Children's grief is completely different, so it is a different entity. We have to learn it separately. What is complicated grief? Complicated grief is a syndrome that occurs in about 10% of bereaved people, results from the failure to transition from this acute to integrated grief. According to the Diagnostic and Statistical Manual 5, it is termed under complex bereavement related disorders. So what actually happens? It is described in this slide. So the acute grief is not transformed to integrated grief. It moves to complicated grief. So what are the factors which determine whether this acute grief is moving to integrated grief or a complicated grief? It is determined by individuals' pre-existing personality and attachment style, genetic makeup, age, health, spirituality and cultural identity, support and resources, the number of losses, nature of the relationship, and type of loss. Actually, I'll be moving fast in these slides because these are mainly the grief reaction in adults. Since most of the studies, concepts, theories are formulated on adult grief, I thought it's important to learn about adult grief first and then move on to the grief reaction in children. So I will be moving a little bit faster in these slides. And what are the types of complicated grief? One is the absent grief. It is characterized by the bereaved acting as nothing has happened, show no feelings of grief or mourning, and become detached from reality as if the death never occurred. Delayed grief may result from pressing responsibilities, for example, funeral arrangements, having to look after their children, that the mourner needs to attend to, results in postponing grief that may last for years. Inhibited grief, where the individual actively inhibit the normal behaviors that are associated with grief. Those who do not allow themselves to experience the pain of grief directly may develop somatic complaints or illnesses. And the chronic grief, where the mourner exhibiting intense grief reactions that are common in the early stages of grief but continue longer after the loss has occurred. There is little or no progress and mourning fails to come to any end. Features of complicated grief. So, in complicated grief, actually, the acute grief is prolonged indefinitely, and symptoms include separation distress, like recurrent painful emotions, intense yearning, preoccupation with thoughts of the loved one, and traumatic distress, where the sense of disbelief regarding the death, anger and bitterness, distressing, intrusive thoughts related to the death, and pronounced avoidance of reminders of the painful loss. As I mentioned earlier, the symptoms may last beyond 6 months, and this inevitable sadness, frustration, anxiety, and depression. They can have maladaptive behaviors like over-involvement in activities related to the disease or excessive avoidance of the memories of the disease. And they also can have suicidal ideas. How? What are the management options of the complicated grief? There can be pharmacological management like antidepressants, anxiolytics, sedatives, and psychological management like grief counseling and CBT. So the complicated grief needs professional involvement. Now I'm moving to the important part of my presentation. So can a child grieve? Dr. Alan Wolflett, a famous grief specialist, says a child who is old enough to love is old enough to grieve. So, grief in children can be longer in duration than adults, and children have different ways of coping with loss than adults. So, they can present with unique symptoms, and they need constantly available adult parenting figure to process a loss and tolerate the painful feelings. And child's identity may be affected by a loss because self-development is still in process. They are still developing. So there can be significant impact on their psychological, social, physical development. Children's limited cognitive development may hinder their understanding of death. They may reprocess things as they mature and acquire capacity at different developmental stages. Grief processes may become intertwined with developmental processes, so difficult to determine when grieving ends and normal development resumes. So that is why I said grief in children is unique and it is very a complicated process which can be affected by multiple factors. What are the long-term effects of bereavement on children? Studies have shown that up to 40% of bereaved children can show disturbances after 1 year. One study has shown that 37 of prepubertal children have developed depression after 1 year, and many can have chronic suicidal ideas. And bereaved children are 5 times more likely to develop a psychiatric disorder. So, what are the factors determine the grief reaction in children? Child's relationship to the person who has died. The personally meaningful relationship. Example, if the loved one is the child's attachment figure, like parent, grandparent, then the grief reaction will be intense. And the secondary loss, that is the consequences after the loss. The life changes after a death. Example, move to a new home, change of school, parent having to work more. So, in these circumstances, the child may need additional support. If not, child can go on to an abnormal grief reaction. And the available social support for the child. Example, if the child is having an emotionally available adult or extended family support, or if the child is having support from friends, then it is a positive factor. And it is also very important the child's age and development. And the other individual factors like social, emotional, cognitive, language, resilience, and sense of self. All these factors determine whether the child is going to, what kind of a grief reaction the child is going to develop. And secure relationship to parents prior to experience of death and general functioning. If the child has had very good relationship with the parent and had good functional level before the incident, then we can think of a better outcome. Let's see how the grief reaction changes in children according to the developmental age. Since I mentioned in the previous slide that the grief reaction can be determined by their developmental stage. So babies and toddlers, they will show irritability, crying, changes to eating and sleeping patterns, difficult to soothe, somatic problems, example constipation, sore tummy, and regression in sleep, eating, wanting to be spoon fed again. They can show behavioral changes like withdrawal, frustration, aggression, and also separation anxiety, clinginess, and fearful of unfamiliar adults. So these are the features we can see in babies and toddlers once they lose their loved ones. Uh, Primary age children, they can have disrupted sleep, nightmares, changes in eating, repetitive questions about the incident, and repetitive questions about the security, maybe, and concerns about safety and abandonment. They may be worried whether the remaining parent may also leave them. And anxiety, somatic complaints like stomachache, headaches, and they may worry about the personal safety and the safety of others. They can also have short periods of strong reaction mixed with appearing as though nothing has happened. So, like emotional fluctuations. They can also have regression, behavioral changes, overactivity, hyperactivity, withdrawal behaviors, aggression, and also learning issues. So, how do the pre-adolescents or adolescents respond to the loss, or the what kind of grief reaction we can see in them? Usually adolescents want to uh, keep the emotional experiences private. They may not want to ventilate their emotions, and they may less likely to seek out comfort or accept support when offered, and more likely to become depressed and withdrawn because they do not want to express their emotions. They do not want to express their weaknesses. So, say, because of that, they might become more depressed and withdrawn. And sometimes they try to escape emotions through acting out behaviors like running away, delinquent behaviors, self harming behaviors. They can experience poor school performance, intellectual uh, difficulties, and also they have some cognitive struggles like unfairness of death and maybe feeling guilty. And since they have greater cognitive capacity at this age, since the abstract thinking, problem solving, reasoning have developed to a certain extent, they may also start ruminations or overthinking. Uh, and sometimes they may have to take the caregiving role for parents and siblings. And they may feel guilty or regret. They also can have questions about their identity, spirituality, beliefs. Anger and risk taking may counteract feelings of helplessness and fear. So they may, instead of feeling helpless and fear, they may counteract it with anger and risk taking behavior. I think this is an important area that we should be aware. What is the concept of death? And concept of death, how the children perceive the concept of death according to their age group. So up to 6 months, uh, children will bring they will not show any response to the loss. And up to 6 months to 1 year, they will feel some sense of something different. 1 to 2 years of age, they will feel sense of displeasure. 2 to 6 years of age, death is understood as temporary and reversible. So they may think that even though that somebody has died, he or she will come back. 6 to 8 years, uh, a clear understanding of death is developing. By age 9 years, children develop the concept of death, very similar to an adult. So, age 9 is the period where they develop the adult kind of death concept about the death. And by 9 to 12 years of age, child's concept of death expands to that held in adult life. After 12 years, death is now viewed abstractly and subjectively since their cognitive skills are developed more. So again, as in adults, stages of grief has 5 stages. Initially, they go to a denial. They start avoiding confusion, shock, fear, and this denial is crucial to help the child to cope and survive, avoiding becoming completely overwhelmed. Immediately, when a child get to know that one of their loved one has died, they will be overwhelmed with their emotions. So, going to a denial is an healthy coping mechanism so that it helps them to prevent them go to this emotionally overwhelmed period. And then they move to anger. Beginning anger is the period where this healing process starts. Uh, they start showing frustration, irritability, anxiety. However, the studies has shown that more truly the child feels the anger, the more quickly the anger will dissipate and the faster the child will heal. That is why we always advise for children to ventilate their emotions. They can cry, they can express their emotions. It is more important to express their emotions and feelings for a proper healing process. And then they start bargaining, clings to a desperate yet false sense of hope. They still holding a false belief or false sense of hope. They may say that I will never be bad again if you just bring my daddy back. Now they are starting to realize that the father has gone, but still they are holding a false sense of hope. Once they start realizing that this is not going to happen again, they go to a depression. This is not the clinical depression we discuss in other people. This depression is completely different. So they feel overwhelmed, helpless, empty, and lack of interest in activities, hopeless. But this depression does not need medical intervention. And then they move to this acceptance. Child re-enters the reality. His or her emotions begin to stabilize. Child comes to terms with the fact that life will never be the same without the deceased uh, parent or loved one, but life can be lived nonetheless. In children, there is no clear definition of what is normal and what is complicated grief in children. However, the intensity of the symptoms and duration of the symptoms, which is usually more than 6 months, and the functional impairment which has created due to these symptoms determines whether child needs professional support. So if the symptoms are so severe, intensely severe, and if the duration is more than 6 months, and if this causes significant functional impairment in child, then definitely the child needs professional support. So, what are the features of complicated grief in children? They can be preoccupied with traumatic memories. They have difficulties in accepting the death. They will have feelings of self-blame, anger, lack of sense of safety, and can have poor attention concentration, difficulties in academic performance, hopeless about the future, nightmares and other sleeping difficulties, overall regression, not having happy or comfortable memories, excessively imitating the deceased person, and persistently seeing the person or have ongoing conversations with the individual. Here, many adults and children can see or can hear the voice of the deceased person on and off. This is something normal. However, seeing this person or hearing this person's voices is persistent, and if it affects the individual's day-to-day functioning, then we have to consider it as a feature of complicated grief. And if the symptoms, what we expect is for symptoms to resolve gradually. But if the symptoms get worse with time, then there should be something wrong. And if the child repeatedly expressing a desire to join the deceased person and suicidal ideas, then child will need professional support. Uh, so let's see what is unique in bereavement in children during COVID-19 pandemic. So as we all are aware, the number of deaths are rising. Now many middle-aged people are also dying. So children may lose their parents, siblings, or grandparents. And what actually happens here is there can be sudden hospitalization after getting infected with COVID-19 infection, and no way to see the loved one after hospitalization, because visitations are not allowed to hospitals when someone is infected with COVID-19 and the whole family has to be quarantined. So they will not get an opportunity to see the loved one, and unable to attend the funeral or see the body after the death due to health restrictions. So as I mentioned in my previous slides, go through the guided mourning or this grief process, funeral activities, talking to other people, emotional ventilation, all these things are needed to go through the normal, natural healing process. So here, all these things are, most of the time, all these things are completely blocked or completely not unable to function, completely stopped. So unable to go through the usual mourning process and limited access to support them. So as we know, usually when someone dies, people visit the house, people keep the body in the house for a couple of days, people visit, the children can ventilate their emotions, people come and talk to them. So now no one is going to visit that family for a couple of minimum 2 weeks or even after that. So they are not getting any support. And limited support, social, cultural, and spiritual support, and social stigma. Limited opportunity to go through the natural healing process due to all these factors. And because of all these factors, there is a high possibility for children to develop complicated or abnormal grief rather than go through normal natural grief process. So they will have difficulties in acceptance because they have not been able to see the body or funeral. So they may deny, they will not accept, and they may develop inhibited grief or absent grief because of not seeing the body, social stigma, no mourning process. So they didn't see anything. They have not seen the funeral. So they may not develop the grief at all. Or some may move to chronic grief. That is due to they may stuck at one stage of grief process and continue it as chronic grief. So how can we support children to go through this difficult process? First thing, what we have to keep in our mind is that talking to a child who is grieving, it can be very overwhelming to us. So it's very important for us to have a backup support or we need some supervision or colleagues to ventilate our emotions in this situation. So it's important to acknowledge that these experiences are a normal part of life cycle, because at the end of the day we all are going to die. So we all are going to lose our loved ones at some part of our life. So it is something which cannot be avoided. If you are born, you are going to die someday. So it is a normal part of our life, and adults to model appropriate grief responses, not to hide them completely or to become totally immobilized by emotions of grief. So, before starting to support the children who are grieving, it's important to know these factors, like individual factors like the child's cognitive, emotional, and social development, his strengths, protective factors, level of functioning before the event. All these things are important to know. And the family dynamics. What is the family, how the family is functioning, what are the support system in the family, and the environment they are living, and the community, and the hereditary and genetic factors, whether the family history of mental health issues, whether intellectual disabilities, developmental immaturities, and the systemic. What are the other stressors for the child and the family, and the current and past events? All these factors are important when we start supporting a child. How to support, when we start to support a child, it is very important to get a better understanding about the child's support system. And one principle is to educate and empower the child's support system. So, who are in this child support system? Child's immediate family, extended family, close friends, community, faith and religion, school, community teachers and staff, and sports groups and clubs. So let's see how we can help children to go through simple or the normal grief process, or to move rather than move into complicated grief process. How can we help? First thing is psychoeducation. There it is important to educate both parents and children about the grief and the developmental needs of children, and build parent confidence, where uh, parents should be empowered and educated that they can support their child to heal, because with these experiences they may also be in an emotional turmoil, so they may feel that they do not have the capacity to support the child. So as healthcare workers, it's our responsibility to empower them and build confidence in parents that they can support their child to heal. And it is also important to identify family dynamics and roles and responsibilities, because in a family, if one family member has died, then these responsibilities, roles, everything is going to be disturbed or disrupted. So it is important to identify the family dynamics and to identify how this family is going to function after this incident. And consistent routines re-establish safety and stability in the family. At the same time, it is important to set appropriate boundaries and family rules. But it is also important to be flexible when needed, because sometimes if one family member dies, then the other family members, maybe if the father dies, the mother may not have consistent rules in the family boundaries, and which can lead to uh, different behavioral disturbances and many maladaptive behaviors in children. So, therefore, it is important to maintain appropriate boundaries and family rules in the family setting. Honest explanation is very important. Honest explanation about the death to the child is very important, and answer the questions as they arise appropriate to the child's needs. Child should be aware about what has happened. It is very important. And at the same time, it's important to assure the physical comfort and nurturing and provide a connection and support for the child during the emotional distress and dysregulation. That is, for child to have an emotionally available adult to express the difficult emotions and to help the child to control his emotional dysregulation. In this scenario, if the child's father has died and if the mother is also not in a position to support the child, we may be able to identify maybe a grandparent or maybe a relative who has a better relationship with the child to have a better connection and to support the child and validate the child's feelings rather than telling the child to suppress the feelings. We should never say that no, you shouldn't cry, you have to control your emotions. It's very important to say, yes, we can understand your feelings, it's okay to cry, you can express your emotions, we are there to listen to your emotions. In that way, it's very important to validate the child's feelings and feel understood. As I mentioned earlier, it's very important to support parents if they are not coping. Because if the parent is not in a position to support the child, then the child will not get that adequate support he or she needs. And it's always have to work systematically with parents and family rather than just to focus on the child, because this is a family and the family has lost the family member, so it's very important to focus systematically rather than focusing only the child situation. And uh, build communication in the family. Uh, so behaviors can be a form of communication. It is important to have a better communication system in the family. They can express their emotions through behaviors, which is acceptable. And it's also important to help children to develop positive or adaptive coping strategies like help seeking behaviors, telling their worries to other people, emotional ventilation, express emotions, rather than maladaptive behaviors like hyperactivity, disruptive behaviors, running away from home, self-harming behaviors. So it's important to help the child to develop adaptive uh, behaviors rather than maladaptive behaviors. And it's also important to explore and understand their subjective experience. Uh, address errors in thinking or misperceptions. Sometimes children might think that it was their fault because they were mad at dad in the morning. Like that, they might think that it has happened because of their fault. So these kind of misconceptions has to be corrected. Otherwise, they will live with this guilt throughout their life, which can be very painful. And it is also important to keep the memories of the disease. Uh, Objects like photo albums, special objects to remember, soft toys, transitional objects for young children, for them to have some good memories about the disease. And it, we can also use art, drawing, storybooks, photo albums, sensory soothing, like these activities to help them to control their difficult emotions. And children may need to know that the surviving parent is healthy, because once they lost their one parent, they might be worried that their remaining surviving parent may also die from the same illness or from some other illness. So it is very important to reassure the child that the surviving parent is healthy. Preparing the child for loss where possible. Example, if the parent is having a terminal illness and if that it is well known that this parent is going to die, then it's important to prepare the child for loss and avoid confusing terms. I think we have seen many times some adults do this, like they do not tell the children the truth about the death. They can say like a parent has gone a long sleep, or they have gone on a trip, they have gone abroad, they will come back. So it's vital to avoid confusing terms like that. It's very important to tell them the truth and help restore child back to healthy developmental pathways, like giving them age appropriate responsibilities, activities, and independence. And parenting factors also need to be addressed. Sometimes after death of one parent, other parent can become overprotective or enmeshed or virulent. So child parentified child. So these kind of parenting difficulties has to be identified and addressed. And children need to continue to develop mastery of their world. So they should give that opportunity to live as a child and explore the world. Professionals can provide a neutral relationship to allow space for conversations that may be difficult for a child to express directly to a parent. For example, fear of hurting or causing harm. If the child is having self-harming ideas, he or she may be worried to express it. With these self-harming ideas, he or she may be struggling. But since the other parent is also suffering, they may not want to express it, and they since then child will start suffering more. So the professionals can provide a neutral relationship to allow space for children to express these difficult feelings and emotions. Uh, Children also need, I think I have been repeatedly mentioned in this, a consistent and safe adult who can help them process this grief process, tolerate difficult and painful emotions, and allow for adjustment to life without the loved one. And it is also important to help children or adolescents to redefine their relationship with their lost loved one and hold on to meaningful memories. So, as I mentioned earlier, now the child is going to live with the meaningful memories of the deceased. At the same time, it is important to let the child to enjoy their activities again. Sometimes children may be worried due to social norms, that they may think that if they play, if they engage in social activities, people might think bad about them, and society expect them to behave in a certain way after they lose their parents, like that. So it is very important to provide them to enjoy their usual activities. Uh, and they can express guilt about their misbehaviors or missed opportunities to express affection or spend time with them before they die. So these issues have to be identified, and uh, it's important to help them to go through this. So it comes to the end of my presentation. So these are the key points when you are dealing with the child who is grieving. The first thing is to provide adequate and correct information according to the child's developmental age and the capacity to understand, and uh, address the fears and anxieties the child is having. Reassure that they are not to be blamed because they may be holding ideas of guilt. And careful listening, validation of feelings, help with overwhelming feelings, and getting involved and getting included into the decision making, and continue routine, model grief behaviors by adults. So adults have to model the usual grief behaviors, then only children can follow these grief behaviors, which will help them to heal, go through the natural healing process. And finally, it is important to provide opportunities to create meaningful memories about the deceased.